Mr. President, last week something remarkable here happened on the floor of the United States Senate. Bipartisanship broke out on the floor of the United States Senate when we had a vote where 40 Republicans were joined by 12 Democrats and 1 independent to vote down a piece of legislation that would have added $250 billion, $250 billion to the federal debt. That $250 billion with interest was $300 billion. That was a vote that was, I think, as we were heading up toward it, highly anticipated that there would be enough support to pass it. But I think what it tells members here of the United States Senate, and probably people around the country, is that there is a certain amount of discomfort among United States senators when it comes to spending, borrowing, adding to the debt $250 billion. And I think that's a good thing. That's the kind of bipartisanship I wish we had more of here in the United States Senate. Bipartisanship in the interest of fiscal discipline and fiscal sanity in this country, I think, would be a welcome surprise for most Americans. And so as we get now into the next stage of the debate on health care, I think I would argue that that was sort of the first vote on health care reform, because it was a health care related vote, and frankly it's something that many of us believe needs to be addressed. The physician reimbursement issue is an issue that Congress deals with on a year-to-year basis. This would have put a 10-year solution in place, but again at a cost of $250 billion, $300 billion with interest, not paid for, borrowed, put on the federal debt. The federal debt, which is already growing at a record pace. Last year, the deficit was $1.4 trillion. The deficit this year is expected to be in a comparable range. And every single year, as we spend more than we're taking in, and we borrow more and more from future generations. In fact, last year, in the fiscal year 2009 that we just concluded, 43 cents out of every dollar that was spent by the federal government was borrowed. And we were talking about putting another $250 billion, $250 billion, $300 billion with interest on that federal debt with the vote last week. And so I was very pleased that bipartisanship did break out here on the floor of the United States Senate, and that we were able to defeat a piece of legislation, frankly, that would have saddled future generations with even more debt than they're already facing. But the next, I think, big issue in the debate over health care, Mr. President, has to do now with whether or not in the legislation that is being written behind closed doors, whether or not there's going to be a so-called public option, which is the phraseology that's now been adopted to describe what I would characterize as a government plan, and whether or not that government plan is going to have an opt-in for states, whether it's going to have an opt-out for states, whether it's going to have a trigger that would take effect somewhere down the road. All these questions, in my mind, are really, they belie the basic fundamental fact that what we're talking about here is government-run health care. Now, whether you have a state opt-in or a state opt-out or some sort of a trigger, the conclusion is still the same, and that is you are going to have a government plan that will compete with the private market health care, the opportunities that are available to most Americans. And so when you do that, of course, you put, I think, the competitive marketplace at an unfair disadvantage, because the government obviously is going to have huge advantages, and eventually over time you're going to see more and more people be pushed into that government plan. You're going to have, I think, more and more employers who are going to drop their coverage as people gravitate toward the government plan. And so I guess my point simply is this, Mr. President, that is that whether or not you call it a state opt-in or a state opt-out or a trigger, a government plan by any other name is still a government plan. What we're talking about is creating a government, a mechanism whereby the federal government can enter into the marketplace and compete against the private sector when it comes to offering health care insurance to people in this country. And that, to me, Mr. President, is an unacceptable outcome, and I hope one that would be defeated. And it seems to me, at least, that the vote last week perhaps is an indication that there already is some discomfort developing among members here in a bipartisan way on the direction in which this health care debate is headed. But the number one concern I think that most Americans have when it comes to health care reform is the issue of cost. It really is, how are my costs, day-to-day costs, or health care going to be impacted by the debate that's occurring in Washington, D.C., and is health care reform going to drive that cost down, or is it going to increase it? And what we have seen now consistently with respect to all the various proposals that are out there, including the more recent version that was released by the Senate Finance Committee, which we finally got a written copy of last week. It's over 1,500 pages. It is currently being merged with the Senate Health Committee version of that legislation, again, in a process which is very closed to most members of the Senate. And a handful of people in a room are developing this. We hope to see that merged version some point here in the not-too-distant future, and to be able to know what it's going to cost, because I think that's a consideration that all of us are going to be very closely following, is what is this health care proposal, this latest version, going to cost. But I think for most Americans, the issue is going to come back to how does it impact my premiums. And we've seen now the Congressional Budget Office, we've seen the actuary at the Department of Health and Human Services, we've seen a number of independent studies that have said that this is going to bend the cost curve up, not down. In other words, you're going to see overall health care costs increase, you're going to see premium costs increase for most Americans. In fact, if you're one of the 185 million Americans who derives their health insurance through their employer, you're going to see higher premiums. There are those who are going to get their insurance through an exchange, 18 million Americans, for whom subsidies would be available. But if you're one of the 185 million Americans who gets your insurance, health care insurance, through your employer, you are not going to be eligible for a subsidy. You are, however, going to be paying the higher taxes that are associated with this and going to see your premiums go up. Now, the most recent, analysis of this, which was released last week by the Department of Health and Human Services, by the chief actuary there, suggested that overall spending for health care at the end of the 10-year period would be up 2.1%. In other words, today we spend about $1 in every $6 of our entire economy, 1/6 of our GDP is spent on health care. At the conclusion, at the end of the 10-year period in 2019, we will be spending 21.3%, or over 1/5 of our entire economy on health care. So $1 in $5 in our economy is going to go to pay for health care at the end of that period. So what does that mean? Well, it means that the health care spending is going to increase by about $750 billion over that period of time. That is the wrong direction to go if you're talking about reform. As I said before, most Americans, when they look at how this impacts them, they want to know that if health care reform that is being acted on by Congress is actually doing something to impact the cost that they pay for health care in a positive way. In other words, that the cost for their premiums, their health care premiums, are going down. And I would argue, Mr. President, again, based upon all the analysis that's been done, and I would say with respect to my state of South Dakota, I've seen several studies that suggest that if you buy your insurance in the individual marketplace as an individual, that you could see your premiums go up as much as 47%. If you're a family buying in the individual marketplace, you could see your premiums go up as much as 50%. There, in fact, have been some analyses that have been done that have suggested that premiums could go up as much as 73% for some people in this country. Now, what does that mean, again, to the average American who's observing this debate? It means that not only are you going to see taxes go up, which, according to the Congressional Budget Office and the Joint Tax Committee, the tax increases in the bill are going to hit the middle income classes the hardest. And in fact, about 90% of the tax burden would be borne by those making less than $200,000 a year. And according to the Joint Committee on Taxation, over 50% of the tax burden would be borne by those making less than $100,000 a year. So your taxes is squarely going to hit right at middle-class Americans. And then you're going to have, if you're a senior over 65, you're going to see significant cuts in Medicare, because that's one of the ways that the new expansion of this program, this new entitlement program, is financed and paid for. And so you're going to see higher taxes, you're going to see cuts to Medicare, and then, ironically, as I said earlier, you're going to see your premiums go up. So the average American has to be sitting out there asking themselves, what is the whole purpose of this exercise? And I think that one of the things that's been advocated in the debate over health care reform is that we've got to cover the people who aren't covered. And there are a lot of Americans who don't have access to health care coverage today. That can be addressed. There are lots of ways that can be addressed, but the way that it's proposed to be addressed here actually leaves 25 million Americans uncovered. So not only have you raised taxes and cut Medicare and increased premiums for people who already have insurance, you leave 25 million Americans without health care coverage. Now, how can you, in any stretch of the word, characterize or define that as health care reform? So, Mr. President, as the debate gets underway, I hope that last week's vote was an indication, at least at the initial stages of this debate, that there is some bipartisan support for constraining spending, for fiscal responsibility, and for fiscal discipline, and that as we get into this, that we can move away from this discussion about, a $2 trillion expansion of the federal government financed with tax increases and Medicare cuts and premium increases for 185 million Americans who get their insurance through their employer, and start focusing on things that actually would provide greater competition and would bend the cost curve down, would drive costs down for most Americans. We believe that that's a fair place to start, and we think there are things that could be done that would accomplish that, one of which is allowing people to buy insurance across state lines, creating a bigger market, more expansive market for health care insurance in this country. One is to also allow people to join larger groups, get the benefit of group purchasing power. We call them small business health plans. It's legislation that's been voted on a number of times here, always been defeated. That we ought to address the issue of medical malpractice reform and defensive medicine, which costs, some estimates are, $100 billion a year in terms of additional spending on health care in this country. There are many solutions that we think make sense, Mr. President, that actually do get at the issue of cost, which, as I said, is I think where most Americans are concerned about health care reform, and where all the bills that we've seen so far, including the one that was released by the Senate Finance Committee, fall short, because it doesn't do anything to impact premiums, health care costs for most Americans, at least those who currently have health insurance. It raises them at the same time that it's raising taxes on working families in this country, cutting Medicare for senior citizens to the tune of $500 billion. And if you annualize, or if you take a fully implemented 10-year time period for this, because bear in mind that many of the tax increases in this bill are implemented immediately, the actual other provisions in the bill are implemented later on down the road in 2013, and so you see a distorted view of what this bill really costs. The 10-year fully implemented cost is $1.8 trillion, almost $2 trillion. Of that amount, of course, it's financed evenly between cuts to Medicare programs as well as tax increases on people in this country. So I don't think that's what we want to see in terms of reform. It certainly isn't what I think the American people are expecting Congress to do. They're expecting health care reform that does do something about getting their costs under control. These bills, this bill, the last bill that we've seen, and of course we've got a bill that's being merged now behind these closed doors, which we hopefully will see in the near future, all fall short on that count. And that's why I hope there will be strong bipartisan opposition to this legislation, and allowing us to start over and in a step-by-step process work in a way that will actually impact in a positive way the cost that most people are paying for insurance in this country by driving the overall cost of health care down rather than up. Mr. President, I yield the floor.